So I'm Andrea Knight. I'm a pediatric rheumatologist at the Children's Hospital of Philadelphia. I'm excited to attend PAS for the first time because typically there's not very good representation from pediatric rheumatology. So we'll be presenting mental health work in pediatric rheumatology.
So my name is Shane Kenyon. I am a general pediatrician, hospitalist, and a health services researcher here at CHOP, and I do work focusing on how to improve the outcomes and reduce disparities for children with asthma. I always feel like there's these sessions that I go to that are like spur of the moment, or something. Someone tells me that they're going to this particular session, and often those are the sessions that I get the most out of, and they're just a new creative way of thinking about things. I've gone to one session where they focus on different ways of visualizing data, which has actually been really helpful for me in terms of thinking about how I put together my own data and reproduce that for broader audiences.
So I'm Siobhan Grushow. I'm a researcher here at PolicyLab, and I'm presenting a research study that's looking at primary care providers' knowledge, attitudes, and experience working with transgender and gender nonconforming youth. This is extremely important because primary care providers are often the only point or first point of contact for this population, and we really wanted to understand, do they actually have the skills and experience to provide quality care? And what we found is more than half of primary care providers actually did not have any knowledge of professional guidelines for working with this population. In addition, more than 80% of them had felt that if they had more training and education, that they would be able to provide better care for these youth.
I'm Alex Fix. I'm one of the faculty members here in PolicyLab. I run an innovative program in primary care called the Possibilities Project, and also direct our Pediatric Research Consortium, our practice-based research network here at CHOP, and the PROS Network, which is a national research network in primary care with the American Academy of Pediatrics. PAS is a unique opportunity to meet with colleagues around the country that just has yielded a variety of different returns. On the one hand, it provides a chance to catch up with old friends and socialize, which is always fun. On the other, it allows really the exchange of ideas with old and new colleagues that have led to the creation of some new grants that might not have otherwise been written. We also have team meetings related to existing grants where we can advance our work and all be in one place without having to set aside separate meetings for different projects.